Hello everyone, and welcome to this audio podcast. This audio podcast is part of a as part of the Labostix Practice Edition of an audio podcast as part of a another sort of radio edition under Storm Labostix production, an audio podcast as part of the LabTide GeForce, and an audio podcast as part of Labostix GeForce, Labostix GeForce. This audio podcast, as part of a Storm Labostix production, will have an overview in line to the European working group for the psychosocial aspects, the psychosocial aspects for those children and young people suffering with forms of chronic kidney disease, or CKD. This overview, this overview, or part of this overview, there will be sort of a sort of a sort of sort of perspective aligned to the remit the remit of EWOPA 2023. It was the 51st the 51st annual meeting of the European Working Group on psychosocial aspects of children or young people with chronic kidney disease, or those suffering with forms of CKD, and the remit has the remit is where the EWOPA is has a remit where it's a multidisciplinary group of sort of professionals, healthcare professionals, and researchers, investigators, who have intrigues in around seeing there is a sort of advances in sort of in the delivery of sort of healthcare services that are bettered for children and young people suffering with CKD or forms of CKD. The meeting looks to connect colleagues looks to connect colleagues amongst academia, research, as well as those on sort of clinical and medical practices, and and the remit also around EWOPA is where there is a sort of a sort of an interplay, looking at how childhood, where different forms of CKD, childhood CKD or chronic kidney disease can be rare, and where there is CKD that is rare, it is at the heart of the European Rare Kidney Disease Referencing Network, or ERCnet. And the EWOPA meeting is fully aligned with also aligned with ERCnet's mission to promote interdisciplinary care and research, and focus on patient needs, or patient care. The EWOPA this year took place in early June 2023, and invites sort of stakeholders caring for children and young people and adults, young people and young adults, or young adults and adolescents with CKD to participate, both with scientific reports and with presentations, around presentations, around activities, interventions, and experiences in everyday clinical practice, with a focus and specific focus on the psychosocial issues and multidisciplinary care for children, young people, and adolescents in forms of in forms of CKD or chronic kidney disease. The organizing committee and scientific committee around EWOPA 2023 had launched some novel aspects, including sort of patient testimonies of adolescents and the parents as well, adolescents, young people, and parents. Number two, prizes for sort of best abstracts. For example, in order to stimulate research and improvement of care and quality, and three, adapted aspects of the remit linked to how certain aspects of healthcare for young people could be or should be bettered through aspects involvement between patients and healthcare professionals, and at the same time, the remit around EWOPA 2023 the remit around the remit around EWOPA 2023 had presentations presentations from experts and sort of early investigators looking at, for example, looking at sort of speech speech impediments in young people suffering with CKD, challenges in around whether it was a case scenario with a young person with CKD stage 4 and CKD stage 4 and with a Bardet syndrome and a sort of lived experience in around that, and the remit also had a perspective from sort of illness related parental stress and challenges, and sort of quality of life in children or young people with CKD, and also looking at sort of a general theme in around schooling and those who suffer with CKD or forms of CKD on forms of renal replacement therapy, and so there were presentations from presenters looking at learning in the pediatric renal nephrology setting in context of those on forms of hemodialysis, and looking at hemodialysis resulting in positive educational development and sort of a case report. And there was also a theme in this year in EWOPA 2023 in around looking at genetics and disease specific aspects. So there was presentations presentations in around the genetic dispositions. There were presentations in around ethical, legal, and social ethical, legal, and social implications of next generation sequencing in context of genetic genetic and molecular aspects around the disease. And there's also presentations from colleagues, from professionals and colleagues, for example, looking at patients and caregivers in context of non-adherence in specific aspects of the disease, and aligned to cystinosis, and also quality of life in adolescent and young autosomal dominant polycystic kidney disease. And there were poster presentations from varying professionals and varying professionals at EWOPA 2023, and there were presentations in around looking at best practice examples, for example, best practice examples, including social media and social media and young people, and looking at unraveling the complex interplay in around that. There were presentations in around disease specific patient information, and there were examples in around multidisciplinary team working to support children, young people, and families in preparation aligned to kidney transplant or renal transplant, and also in around the theme under a theme aligned to ethical and legal decision in making ethical and legal decision making in complex patients, where presentations included looking at decision making and deprivation of liberty in end stage renal disease, and also presentations from experiences experiences from those children or young people diagnosed with forms of kidney disease or chronic kidney disease, and where such examples or cases in the presentations had been highlighted, who had lack capacity as well in context of cognition, and there were also presentations in around CKD and the multidisciplinary team. Again, where there were presentations in the ethical dilemmas around ethical and medical dilemmas. There were presentations in around adherence, adherence amongst adolescents and young people, aspects of there were presentations in around CKD, looking at the CKD chronic kidney disease clinics and dialysis, and what could be done better. There were presentations in around identifying obstacles for living donor kidney transplantation among pediatrics and young people, and there were presentations in around the theme around transition of children and young people into adult renal care or renal services. So presentations included transition from a perspective of a pediatric nephrologist. There were presentations from looking at sort of barriers to the successful healthcare transition of patients with kidney disease, and presentations looking at transition from the perspective of the adult nephrologist as well. The poster presentations at EWOPA 2023 also included sort of examples of an educational project in context of hemodialysis and pediatrics, looking at disease burden and disease progression of young adult patients with autosomal dominant polycystic kidney disease, and there were poster presentations looking at the study on the experience of pain, quality of life, and symptoms of anxiety in context of young people and adolescents in autosomal dominant polycystic kidney disease. Presentations from the need around the need for service evaluation for young people with chronic kidney disease. There were presentations from in around the clinical characteristics and outcome of patients with atypical hemolytic uremic syndrome, and poster presentations looking at sort of nurse-driven pediatric procedural sedation and analgesia, and the analgesia team in a particular at a particular pediatric hospital site, hospital example. So the EWOPA again, the EWOPA 2023 took place in early June 2023. The EWOPA website had information in around where the scientific committee and EWOPA welcomed abstracts, for example, for poster and oral presentation, for oral presentation, and the EWOPA was organized linking between sort of pediatric nephrology specialists and also those who endorsed the remit endorsed the remit from whether the remit around EWOPA 2023 was endorsed by the European Society of Pediatric Nephrology as well, and the website, the EWOPA website, had information in regard to where further information can be identified, and the abstracts again look to gain a sort of the abstracts put forward and sort of encouraged by the scientific and organizing committee look to gain perspectives from in around sort of experiences, interventions, activities, sort of clinical practices, medical practices, as well as sort of the ethical issues, the genetics and pediatric kidney disease or renal disease, and looking at sort of aspects around translational and transitional clinical practices as well. So viewers are welcome to check out the EWOPA website website. There will be further information alongside this audio podcast as part of this audio podcast, and those checking out this audio podcast can identify further information through the audio podcast through Storm Labostix through Storm Labostix social media as well. So that draws this audio podcast to a close. Again, this audio podcast will be on different forms of Storm Labostix production social media. And once again, thank you for tuning in. This has been an audio podcast as part of the Labostix Practice Edition, an audio podcast as part of the LabTide G-Force, and an audio podcast as part of the Labostix G-Force, and an audio podcast as part of a Storm Labostix production and an audio podcast sort of as part of Biomedical Science Day, as part of Biomedical Science Day 2023. Thank you again for tuning in on this sort of overview of the EWOPA 2023. Thank you.